Here we are going to discuss some important topics under head and neck region. So in this topic we will be covering some important topics such as from starting scalp, then after we will be dealing with face. In face we are dealing with its muscles, vessels and nerve along with lymphatic drainage. Along with that we will be dealing with neck region, and in neck region we are going to see triangles such as anterior and posterior triangles, and also in the back of neck we will be having suboccipital triangle. So along with this we are going to finish the neck region, and then we will be dealing with glands such as parotid, submandibular and thyroid gland, and then we will be having some topics such as regions dealing with temporal and infratemporal regions, and also we are going to deal with interior of the cranium and also the orbit region along with nose and paranasal sinuses, palate, tongue, along with that pharynx, palatine tonsil, and we will be dealing with larynx and also about the details of middle ear along with facial nerve. So under these topics we are going to see detailed structure of head and neck. So before moving into the detailed structure, we will just orient ourselves with the head and neck region. So head and neck region, as you are seeing here, we'll be having skull, and then skull it is covered by muscles which are again supplied by vessels and nerves. So here in this picture you can make out muscles in the anterior part. So here what you are seeing is muscles, and then we'll be having some important topics such as we'll be dissecting all these muscles, and once you dissect these muscles you will approach the cranium along with the facial skeleton, and then we'll be having some important topics such as scalp. In the scalp region we are going to deal with aponeurosis, which you can see here clearly. So this is the aponeurosis which is dealt in the scalp region, and then we will be having neck region, and this part we will call as back of neck. So in back of neck we will be dealing with suboccipital region. So this region we will call as suboccipital region, which is just present below the occipital bone. So if you remove this cranial aponeurosis, you can make out the bones in the posterior aspect of the skull, such as we will be having occipital bone which is present posteriorly, and then we will be having paired parietal bone which is present either on the right side and also in the left side, and then we will be having some other bones which is present in the anterior aspect of the head region. So those bones are, we will be having frontal bone, so which is unpaired bone. So frontal bone which is an unpaired bone, and two parietal bones which we seen. Behind that we will be having occipital bone, and then we will be having all this facial bones covered by muscles with vessels and nerves. So here you can make out those structures also. So I am removing the muscles seen around the eye region and nose region. So you can make out some vessels passing between these muscles. So these are the vessels which are going to supply the face region. About all these things we will deal detailedly, and now just orient how it is seen. So in neck region, if you are seeing, we seen back of the neck. This is the front of neck in one side. So in one side you can make out this bone as clavicle, and above the bone you can make out some muscles such as sternocleidomastoid. So if you remove those muscles you can get into deep structures present in the neck region such as vein, artery and some nerves along with lymphatic vessels. So these structures which are very important for your exam purpose also. And then we will be having some glands present in the head and neck region. So here you can make out glands which is seen near to the ear. So this gland will be called as parotid gland. Same way below the mandible we will be having submandibular gland, and below the tongue we will be having sublingual gland. So about all these structures we are going to see detailedly. So vessels and nerves forming the major supply seen in the head and neck region, and then we'll be having muscles covering all these things, and then we'll be having in the innermost part skull bones and facial bones. So now we will enter into the details of all these things separately. So first we are going to deal with the topic called scalp region. So scalp region. So now we are going to see about scalp region. So talking about scalp, it is a soft tissue which is going to cover the calvaria of the skull, and it is going to extend from the anterior to posterior aspect. In the anterior aspect, it is going to extend from supraorbital margin, the margin which is present above the eyes, that is, or above the orbital region, we will call it as supraorbital region. So above the supraorbital region, we will be having the extend in the anterior aspect. Then after, it is going towards sidewise. So this is supraorbital margin, and then we are going to move the scalp towards the sideways. So side, here we will be having zygomatic arch. So in the zygomatic arch, we will be having side extent of the scalp region. So anteriorly it is extending from the supraorbital margin, and on the sides through the zygomatic arch, and then towards the posterior aspect it is extending till the external occipital protuberance which is present here. Then after, it is going to extend in the lateral aspect in towards the superior nuchal line. So here we will be having superior nuchal line, and till the superior nuchal line we will be having posterior extent of scalp region. So scalp region, it is the soft tissue which is going to cover whole of the calvaria of the skull, and anteriorly it is extending from supraorbital margin, and the posteriorly it is extending till external occipital protuberance, and laterally in the posterior aspect it is extending till the superior nuchal line, and laterally it is extending towards the upper border of zygomatic arch. Then anteriorly, that is supraorbital margin. So these are the extent of scalp region, and this scalp region we are again dividing into 5 layers such as skin, loose connective tissue. Then we will be having third layer as epicranial aponeurosis or aponeurotic part, otherwise known as gallia aponeurotica. Then fourth layer we will call as loose aponeurotic tissue, and then below that we will have pericranium. All these things we are going to deal now detailedly in upcoming slides. Now we will just see what are the structures we can see through here in a 3D image. Among the 5 layers, first layer we will call as skin, and this skin, it is not seen here, we have removed the skin, and the 5 layers such as skin, close network of subcutaneous tissue, aponeurosis, loose aponeurotic tissue, and pericranium will be seen. In that, first 2 layers are removed, and now what we are seeing is third layer of the scalp region. About skin region, it is just a thick area which will be having numerous hair, and then it will be having sebaceous and sweat glands, and also it is more prone for sebaceous cyst. About those we will deal again later. Now we will move on to dense subcutaneous tissue. This is the area which will be having more number of fibrofatty tissue, and it is going to connect the overlying skin area with this aponeurotic area. And here we will be having some applied aspects such as subcutaneous hemorrhage that will be happening more prone in the second layer of scalp region. Talking about the third layer, in third layer we will be calling as epicranius region, that is gallia aponeurotica will be seen. So here you can make out anteriorly muscle, and then posteriorly again we will be having paired muscle. Between the two muscles we will be having epicranial aponeurosis. So this is the epicranial aponeurosis seen between two muscles. The name of the muscles are such as posteriorly the belly is what we are seeing as occipital belly, and then we will be having in anterior aspect we will call as frontal belly. So together these two muscles will be called as occipitofrontalis muscle. So in the third layer we will be having in between these two bellies we will be having an aponeurotic sheath that we will call as epicranial aponeurosis or else gallia aponeurotica. Now we will move on to the third layer, fourth layer. So in fourth layer, once you remove this epicranial aponeurosis and the bellies, you can make out some area, and that area will be called as loose aponeurotic tissue. So that also not visible here. Just below this fourth layer, we will be having another layer which is going to be intimately covering the bones of the skull region, and that part we will call as pericranium. So altogether these are the 5 layers we are going to deal in this scalp region. So here you can make out some vessels, and also scalp is a region which is having dense amount of vascular supply and nervous supply along with its lymphatic drainage.